So now I'm really pleased that Hilaria is here. Hilaria has got the best outfit on and the best glasses. Woohoo! And this lady is very, very passionate about maternal health, kidney disease, and what we all need to do with it and be better at. Is that all right?
Yeah.
Thank you so much for coming.
Thank you. I'm going to time myself because I tend to overtalk and keep going because I'm really passionate about what I'm going to talk today. So good morning, everybody. I'm really pleased to see the room full with GPs because I am actually doing a research on behalf of GPs and to see how we can work with you to adapt your communication to be more culturally sensitive. That is my project because I'm really passionate. But first, it is an honor and special privilege to be at this meeting with you this morning. I'm grateful to Angie for this opportunity to share my story and speak on a topic that's so close to my heart, the importance of healthcare equity and the important and transformative role of each of you as general practitioners, family doctors. That is what you are, and that is a very important role. And when people talk about GPs, they tend to say, oh, but one thing you have to understand as GPs is that you have that expertise in every field. So you are special. It's because before we had specialists, there were GPs. It was you we came to for help. It was you we came to ask for solutions to the diseases we had. Before they started talking about specialists in different areas. So please own it, take it, yeah? You're still the original of all, yeah? So my journey began in 2008 when I had a miscarriage at 22 weeks, which deteriorated to septicemia, multiple organ failure, 2 cardiac arrests, and I was in a coma for 2 weeks. And when I came out of that coma, it had affected my kidneys, so I had to go on dialysis. Looking at me now, you wouldn't know that. But believe me, makeup, that is why I always try to be so glamorous and, I dress the way I do because if I take my makeup off, you will see the ravages of kidney disease on me. And believe me, I was a model when I was younger, and it was always drummed into us. You must always look your best when you go out. And that has continued till today. For me, if I'm not looking good, I'm not stepping out of the house. If I don't have my war paint on, I'm not stepping out of the house. So imagine when kidney disease turned me into a shadow of myself and I couldn't leave the house. I couldn't wear my heels. And at a point, I was being offered a wheelchair. And I said, not gonna happen. I have 6 inches heels in my wardrobe. Who's gonna wear all of them? I'm not sitting in that. Give me crutches. And believe me, because of that determination, I stood up again after that first time of multiple organ failure. I went on dialysis and my kidneys picked up a bit, but it happened again in 2010, barely 2 years later. Same thing, miscarriage at 22 weeks, multiple organ failure, 2 cardiac arrests. And this time, whilst they were extubating me, my lungs collapsed and they had to reintubate me to save my life. So I believe I'm a miracle. So no matter what I'm facing, I was telling Angie today, looking at me, I am suffering, I'm in pain standing here. But the fact that I am breathing air and I can get out of my bed in the morning, I will get up. My GP has been awesome to me. Every time I call them and I say, this is wrong, they are ready to spring into action. Unfortunately, there's not enough resources for GPs, for them to do their job, for them to give the time to their patients, but the little time they have, transplant team as well are really good. So when this happened, I thought my life was over. But this journey was not just a part of health challenges, but it was a revelation of the disparities that exist within our healthcare system, especially for the Black community. In 2018, or before this time, I went through a lot. Hell, in fact. I was in and out of hospital. I'm prone to septicemia, and it was crazy the way I was ill. I was always being admitted. I thought I was going to die. So I had to teach my kids to be independent. They were 6 and 7 when this whole thing started. Today, I'm 52. And, the fact that, I'm at that age, I was 30-something when this whole thing started. And how many years later? My son is 23, my daughter is 22. And I'm still here, I'm still standing. But however, the system from that time has not changed. It remains the same. So I was on dialysis for 10 years, waiting for a transplant, begging, in pain, having to do my own dialysis. I've gone through the different types of dialysis, believe me. And each time something happened. And I had to pick myself up and get out there again. However, in 2018, a mother who lost her son in very tragic circumstances agreed to organ donation. I was blessed with a kidney transplant that saved my life. I'll be forever grateful no matter who or what I become in the future. It set me on a mission to ensure others from my community have access to the care and support they need. My passion for this cause had led me to establish the WSH BME Kidney Network. So WSH is Warriors, Survivors, and Heroes. So if you know the renal community, Warriors, Survivors, and Heroes refers to, different stages of your kidney journey. So I've been all through the three stages. So this time, what do I do? What can I do? Is to use that experience I've had through those different stages to educate not just my community, but doctors, politicians, you name them. I would go, and even up to Parliament. At 8 weeks after transplant, I was in Parliament talking about my story, asking the government to find a way to reduce those health inequalities that affect us. Because believe me, it was mistakes that were made. But I don't dwell on the mistakes that were made. I dwell on the fact that I am alive, I'm breathing, I'm able to actually see my children grow up. My younger sisters were in their teens when I got married. And when I had this whole episode. But today, they're all married with their children, so able to go. If there's any Nigerian in this room, you understand what omugo is, which is where a mother goes to look after her daughter's children and the woman. I was able to do that for my younger sister 3 times. Imagine that. I didn't have any hope that I was going to do that. But it's because of the doctors and the nurses and the GPs that did their job to ensure that I am here to see my children grow up, to see my sisters grow up, get married, have children, and have careers. So my mission today in setting up WSH BME Kidney Network, the first of its kind dedicated to advocating for Black minority ethnic people living with or at risk of kidney disease. Our mission was to provide essential advocacy services, raise awareness about organ donation, and address the systemic health inequalities that plague our communities. And believe me, I am doing that. If you check for me online, you will see I don't hold back. And yes, I'm not well loved for it, but to get results, you need to actually break some tables. yeah, or shake some tables. I don't shake, I break. Because if nobody is telling the people who are in charge that this is what needs to be done, then nothing will be done. Throughout my journey, I've had the privilege of working with NHS renal consultants on my platform, calling them to come on and talk to people from my community about organ donation, about kidney disease, about their fears, about those myths that are going around on the internet. I'm an NHS blood and transplant ambassador. I'm a peer educator and ambassador with Kidney Research UK. I am a researcher with Fairer Health for All Fellowship. I don't know if you've heard of them. I also am involved in research across the UK. You name it. As long as it's something to do with my community and health inequalities, Hilary is there. I don't mind. I will do it. At national level, I'm on the organ utilization group. I was on that team, which is a group set up by the Secretary of State for Health and Social Care. And what we're looking at is how they can or how organs are used, how they are located. And in making those recommendations, I wanted the voices of people from my community to feature. And I pushed for that. I went into my community, both Black and Asian. I said, if we don't go in there and tell them what we want, nothing is going to happen for them to find a solution, because we are most at risk of kidney disease because of high blood pressure and diabetes. Unfortunately, I came in through a miscarriage, and I always tell my story. So I was on that team. And then when they put the recommendations forward to the minister, they set up an implementation committee, and I was asked to come on. And again, Hilary is not scared. I would speak. They put in the recommendations. I said, what about the ethnic communities? How are these recommendations going to affect them or improve their quality of life as kidney patients or prone to kidney disease? Because when we need organs, it's mostly kidneys. So what is going to be done? That is being incorporated. They are working, they're asking people from my community to come on. I am pulling people and saying, you need to get on that subcommittee so our voice will be represented. Because they're tired of hearing me, so get fresh voices in. So I'm doing that. But my efforts are not confined to healthcare alone. As a former chair of the Black and Asian Police Association and Equality Officer for the Greater Manchester United Community Branch, I've been involved in numerous campaigns to address broader social injustices, from advocating for domestic violence survivors to campaigning for public services and housing. My commitment has always been to uplift and empower those in need. My experiences have taught me that challenges we face are not insurmountable. Despite personal health setbacks, including septicemia, cardiac arrest, and time spent in a coma, I refused to let my illness define me. Instead, I found strength in service, dedicating my darkest hours to volunteering and advocacy. I still do today. I'm in a lot of organizations, charities. I would go out to any events. When Angie told me, Hilary, there's an event like this, I said, sign me up, because I don't mind. I don't work for anybody. I made that conscious decision a long time ago not to work for anybody, because this is a life ambition. To go around talking to people like you, to tell you what we face and how we can work together. And my story is not unique. There are other people like me who have had worse or less, but we're all working together. My experience is a testament to the resilience and determination of countless people like me who face systemic inequalities. It is a call to action for us all, especially for you in the healthcare profession. You have the power to change the narrative, to bridge the gaps, and to provide equitable care for all. As healthcare professionals, I want to talk specifically to you now. As healthcare professionals, you are the front line of this change. Your role extends beyond treating ailments. It encompasses advocating for your patients, understanding their unique challenges, being easily accessible to those who will normally not choose you as their first point of contact for any health ailment, adapting your mode of communication in a culturally sensitive way to build that trust and rapport, and working tirelessly to ensure that everyone receives the care they deserve. You can make a difference. When a patient comes to you and they are unable to speak, I know that you only have about 10 minutes to speak to a patient, but there are times you might have that extra time. Take it, speak to that person. I know some GP practices have, they have this translator service. Look for it. It might be a language barrier. Find community champions who are passionate like me, who want to work with you within the community. Because when you have those people and you're giving somebody that bad news, that person from that community will be able to help you to pass that message on. I'm not saying turn them into medical doctors, no. It's using the expertise they have of their own communities to communicate with people within their communities. That is the best way forward. Because for us, when we see someone like us, who looks like us, speaks like us, right now, I've changed my voice so that you can understand what I'm saying. But if I see a Nigerian, my voice changes and you cannot understand a word of what I said. Because we go into our lingo. And when we speak, at the top of our voices that you think we're fighting. We're not, we're happy. And sometimes in hospitals, as I tell doctors, I go to training for newly appointed consultants, and I tell them, when you see a patient in the hospital and that patient is talking to you in a brusque way or an abrupt way, they're not being rude, that's the way we speak. And some of them come into the UK, they are not used to the system yet, and you meet them in the hospital for the first time, you think they are being rude, they are not. And we speak very fast. I've had to slow down my speech so you can understand me. When I'm with my people, I speak as if I've got hot yam in my mouth or hot potatoes in my mouth. That's the way most of us speak. And our voices go very guttural, so you won't understand what we're saying. And we speak our lingo. So as I said, you can make a difference, that difference that can impact millions. Can you today promise me that you would commit to becoming the advocates your patients need, and to ensuring that the healthcare system is one of equity, compassion, and excellence? Can you do that? We often hear or say that the system is complicated, the healthcare system is complicated. I agree, it is complicated, because the healthcare system wasn't built for people from diverse communities. It was built for the people, the white people, the British people. So by the time immigration exploded and people from different countries were coming into the country, from Africa, from Asia, from wherever, the system was not prepared for it. So that is why we have health inequalities. Because when you see a child who's got meningitis, usually the advice is if you put a glass against the skin, you see the spots come up. Now, black skin, how would you see it? When I was having septicemia, the doctors didn't realize it. The second time, I was dying. They didn't even realize it. It was my husband, who is also a doctor, who was there, could see it. And he said, she's becoming septic. Take her in very quickly. I would have died. So the system is not set up for us as black people or diverse communities coming into the UK. So you, as GPs, you are the first point of contact. So use that influence. Don't think that the consultants in the hospital are the be-all end-all. No, they're not. You are. Because you've got the experience. You see it every day. You see it start. You do the test. You do everything. You see it start. So why do you take a step back when the patient comes in and says, this is wrong? And you say, no, we'll have to refer you to the hospital. Try and treat it as much as you can, because then you're building that relationship. I'm talking from my experience. But I challenge you to rethink this notion. I was watching this drama series. I like to watch series because I use the films as analogies when I am speaking. The New Amsterdam, if you've not seen it, is a drama series. Go watch it. At the very first episode, where the new chief medical director was introducing himself as the director, he made a speech, and at the end he said, we say the system can't be changed, but we are the systems. He was talking to the doctors, to the staff. I am saying the same to you today. We say the system is complicated, and I say, yes, it is. But you all in here are the system. You use it. You know how it works. So you are the system. That change you want to see starts with you. Change it. Thank you.